Lymphoma is the most common type of hematopoietic cancer seen in dogs. It is a progressively fatal disease caused by abnormal growth of lymphocytes. Lymphoma usually arises from primary and secondary lymphoid tissue, such as bone marrow, thymus, lymph nodes, and spleen. It is malignant in nature and presents in a variety of forms. Multicentric lymphoma affecting peripheral lymph nodes is the most common presentation seen in dogs, accounting for 80% of cases. The cause of canine lymphoma is somewhat unknown. However, factors such as environmental contamination, radiation or oxidative stress, magnetic field exposure, or defective immune system may play a role. Due to the systemic nature of the disease, chemotherapy is usually the first choice in treatment. Unfortunately, not many cases of lymphoma are cured as such, rather they are managed for extended periods of time. Generally, the prognosis for B-cell lymphoma is better than for T-cell lymphoma in terms of remission and survival times. Doxorubicin is an anticycline antibiotic derived from streptomyces. It is one of the most widely used anti-neoplastic drugs for the treatment of lymphosarcoma in dogs. Doxorubicin works via multiple mechanisms. It causes intercalation of DNA, resulting in uncoiling of the DNA helix and inhibition of protein synthesis. It causes DNA fragmentation by inhibiting topoimerase II enzyme. It also causes the formation of free radicals such as hydrogen peroxide and hydroxyl, which causes oxidative damage to DNA and cell membranes. Although it is not cell cycle specific, it is most active during the S phase when DNA is being replicated. Doxorubicin may be used either as a single agent or in combinational therapy, most commonly with cyclophosphamide, vincristine, and prednisolone, the CHOP-based protocol. A lot of primary research has looked at remission rates, survival times, and disease-free interval for patients on doxorubicin. The general consensus is that multi-agent therapy with doxorubicin is more effective than single-agent usage, and thus the CHOP protocol is standard in most oncology referral centres. However, single-agent doxorubicin may still be used on the basis of financial or logistical reasons for clients. A case series study looking at dogs with B-cell lymphoma found an overall response rate of 78%, with median remission time and overall survival time to be 80.5 and 169.5 days respectively. However, this descriptive type of study offers no comparison with other study groups. A second case control study found remission rates to be greater than 90% using a CHOP-based protocol with and without a maintenance period. Furthermore, they found no significant difference in disease-free interval and survival time between groups, suggesting a maintenance period may not be necessary. Although this study design doesn't offer the highest proof of causation, the remission rates are much higher than the previous study discussed. A non-randomized clinical control trial, which offers stronger evidence than the previous study, compared a multi-agent chemotherapy protocol with a single-agent protocol. The study found remission rates of 73% for the multi-agent protocol and 53% for the single agent, which is lower than previously described. Although there was no significant difference between treatments for remission rates and survival time, the lack of power in this study may have failed to detect smaller differences. An important consideration practitioners must take into account are the side effects associated with doxorubicin. The major side effect is a dose-dependent cardiotoxicity, a result of free radical myocardial damage. As a result, doxorubicin is contraindicated in patients with existing cardiomyopathies. From the evidence researched, it appears doxorubicin in combinational therapy is the best approach for treatment of canine lymphoma. However, there is the need for more randomized control trials in this area to determine optimal protocols and lengths of treatment.